Good morning, everyone. My name is Sheery Deyanira. Let me ask you something. How many of you have ever taken medicines without consulting to a doctor first? Maybe you had a fever, a headache, or a stomachache and you just took whatever was available at your home. That's what we call as self-medications. And while it seems harmless, it can actually be very dangerous if we don't do it properly. Self-medications is common, but it's not always safe. In Indonesia, study shows that 35.2% of family stock medicines for self-medications. It is understandable because sometimes going to a doctor is expensive and also inconvenient for minor disease and we just want a quick fix. But here's the problem. Not everyone knows how to use medications correctly. Many people take the wrong drugs, use incorrect dosage, and also mix medicines without knowing the effect. So, what are the risks? First, it is the incorrect dosage and also misuse. Many people assume that taking a higher dose will make them heal faster and easier. But in reality, it can cause poisonings, organ damage, or even be more fatal. On the other hand, taking too little medicines might make the treatment ineffective, allowing the disease to get worsened. For the next risk is antibiotic resistance. One of the most serious consequences of self-medications is the overuse of antibiotics. Many people take antibiotics for minor illness like the flu, even though antibiotics don't even work on viruses. Over time, this leads to antibiotic resistance, making infections harder to treat in the future. The World Health Organization has identified antibiotics resistance as one of the biggest threats to the global health today. For the next risk is wrong medicational choices. Imagine someone taking painkiller for stomach pain without knowing they have appendicitis. These things can mask symptoms and delay proper treatment, leading to dangerous complications. The same goes for people who take expired drugs or mix multiple medicines without knowing the interactions, which can cause harmful side effects. Teenagers are especially at risk because we're at an age where we start making independent choices or decisions. We see medicines advertisements, hear recommendations from friends, and often assume that if a drug works once, it will always work in another time. But do we really understand what we're taking? Study shows that while many teenagers engage in self-medications, they lack the proper knowledge to do it safely. So, what is the solutions? First, we need a better health education. Program like Gema Cermat or Gerakan Masyarakat Cermat Menggunakan Obat in Indonesia promote responsible medicine use, but obviously it is not enough. Schools should teach students about the safe use of medications, drug interactions, and also the dangers of misuse. For the next one is we need awareness. Instead of blindly following advertisements or advice from friends, we should be more critical about what we consume. Next, we should always consult to professional too, whether it is a doctor, pharmacist, or health worker, because getting the right information is important for our safety too. Instead of guessing or following advice from unreliable sources, we should take the time to learn and also ask trusted experts. With platforms like Our Doctor or other online consultation services, getting professional medical advice is now easier than ever, helping us to make the right choices before taking any medication. Self-medications isn't entirely harmful if it's done correctly, but without proper knowledge, it becomes a serious health risk. While it provides convenience and accessibility, especially for minor illness, improper use can lead us to dangerous consequences. At the end of the day, our well-being is on our own hand. We must be mindful of what we consume, think critically before taking any medications, and ensure our choices are based on accurate information. By staying informed and cautious, we can protect ourselves and contribute to a healthier, more knowledgeable society. Let's prioritize safe and responsible healthcare practices because prevention is always better than curing. That's all from me. Thank you!